Hello and welcome to the third edition of our dry eye video series. My name is Dr. Jason Miller. In our last segment, we discussed corneal staining. In this segment, we're going to evaluate the eyelids and how it's related to ocular surface disease. Before examining your patient's eyelids, it's important for you to talk to them about what you're looking for and why.
Are you talking to me?
See, your eyelids contain these special glands called meibomian glands, which help produce the outer layer of the tear film. If this layer is defective, it may explain the problems you've been having. Defective meibomian glands can lead to tears breaking up and leaving patches of dry areas on your ocular surface. Following an evaluation of the tear film breakup time with fluorescein and lid wiper epitheliopathy with lissamine green, we move on to a thorough evaluation of the eyelids and meibomian glands. Meibomian gland disease, MGD, or posterior blepharitis is now often thought to be one of the primary causes of ocular surface disease. It is a chronic progressive disorder. It results in obstructed meibomian glands, telangiectasia, dislocation of the glands, scarring, notching, thickened secretions, and gland fallout. Yikes! There are many views as to how this disease starts. Does OSD result in MGD, or MGD result in OSD? Which comes first, the chicken or the egg? We don't really know right now. Whoever the culprit is, the eyelids are a critical structure to evaluate. Don't forget to talk to your patients about how the typical patient blinks about every 10 seconds. While using digital devices and with an increasing near demand on their eyes, in today's digital world, that blink rate drops. If their tears are not staying on their ocular surface long enough, it results in dry patches, and this in turn leads to a cycle of dryness and ocular surface inflammation. Before expressing, look at the gland orifices to look for any patent or capped glands. Now, let's talk about meibomian gland expression. It is important to heat the glands prior to expression. I use a Bruder mask here. Warm the mask for 20 seconds in the microwave and have the patient wear the mask for 10 minutes prior to expression. Next, the expression. Various expression tools are available, like the Mistrata paddle, but even a fancy Q-tip works nicely. I like to express the center and nasal glands as they are the easiest to express. Evaluate how much is being expressed and the consistency of what is expressed. If low or thickened expressions, like toothpaste, we have a problem. Next stop, treatment options. Your patients need to first understand the importance of gland health and how it is the primary reason for their visual discomfort. Explain to them how to properly take care of their eyelids. Warm compresses may have limited efficacy, but they are a good place to start. A Bruder mask may be an effective nightly procedure for the patient. Lid scrubs, like OcuSoft, are a potential treatment as well. Depending on the severity of the glands, anti-infective or anti-inflammatory eye drops and even oral antibiotics like doxycycline can also be effective. But if you want your patients to adhere to their treatment, show them exactly what you are treating. Show your patients a picture of their eyelid staining or their rapid tear film breakup time taken on their own smartphone. It helps them understand this issue with their own eyes when they actually see the test results for themselves. After all, seeing is believing. Now that you've evaluated the eyelids and obtained the necessary diagnostic information for treating their dry eyes, it's time to communicate to the patient. Join us next time when we discuss how to best communicate to your patient about how to manage their dry eye situation.